Hi there, Alan here from AllMed. Okay, and here we are at Archer Dental. First thing we're going to do is check the baseline for the ventilation standards in the building itself and just see how well the space is being flushed. Carbon dioxide being monitored with the AirNet 4 there is a metabolically introduced tracer gas opportunity. Outdoor CO2 levels around 415 parts per million. Your breathing, your exhalation gas is in the magnitude of 40,000 parts per million. So when we introduce CO2 into the space, we're able to use a monitoring device to determine what the flushing rate is of the building HVAC system. And here we have our Seabreeze condensed moisture airflow visualizer, which is our laboratory grade fog testing device. This is emitting a laboratory grade fog that is used for tracing airflow within a space, as air will always take the path of least resistance, and this is one of several ways in which you can actually see where the air is moving. Okay, here we're going to test airflow visualizing from this laminar ceiling diffuser. Here you can see the pattern of air sticking across the ceiling, indicating we've got good supply ventilation coming in this space. Okay, and now we're going to be checking exhaust from the room, verifying, again, air will always take the path of least resistance. Exhaust working well. Here we're getting good exhaust ventilation out of this space. Okay, here we are with our virus killer VK401, which we're setting up to install today at Archer Dental. Difference between technology and virus killer and any other air purifier is not only does virus killer contain good quality HEPA filtration, which everybody has heard about. Virus killer approach is that HEPA filtration is only half the solution. So while HEPA filtration will capture a good amount of particles from the air, it will not capture everything. Virus killer technology, developed in 2004 post-SARS out of South Korea, was mandated to provide single-pass disinfection. So what that means is the air that's pulled in and through the HEPA filter, whatever does get through the HEPA filter, then has to pass by powerful UVC lamps as well as a photocatalytic oxidation reaction that occurs in the patented reactor modules. Then it passes through some carbon filtration. The end result is a 99.9999% clean air log 6 pathogen reduction from virus killer technology.